Real news for Americans 50 plus. This is Emeritus News Channel.
Thanks, Glenn, and thanks for being here. What I'd like to do is update you on where we are with the virus, where we are with the vaccine, and what we're beginning to see in terms of both of them. Also to discuss some of the concerns that we've been hearing out in the field about the vaccine in particular. As of today, influenza is widespread in most of the United States. We're seeing it continuing to increase in some areas. We're seeing a slight decrease in some areas. And we know that it's now present throughout the United States. It still remains overwhelmingly H1N1 pandemic influenza. And influenza is a tough enemy. It's unpredictable, and one of our biggest challenges is continuing to anticipate what it might do next. Although there has been a slight decrease nationally and in some areas, in other areas it's still on the upswing. We wish we could predict the future, but we can't. We do know that flu season generally lasts well into May. So we've got many, many months ahead of us where we don't know what will happen, and we need to take the best steps we can to protect ourselves. Vaccine efforts are starting, and all states in the U.S. have ordered vaccine. It is being delivered, and each Friday we will provide information on the amount of vaccine available to each state and the amount of vaccine which each state has ordered. That's a little complicated because, as I have explained before, what we've decided to do is make vaccine available as soon as it comes off the production line. That means that it's coming available in lots, and states learn each day of additional vaccine available to them. It's a little bit of a messy process, and we do expect it to be somewhat bumpy in the first few weeks, but this is the best way to get vaccine out and available as soon as it becomes available. This week, the flu vaccine became available in the intranasal mist variety, and next week it will begin becoming available in the injectable variety. The first flu vaccinations of the season were done yesterday in many states throughout the country, with a priority on healthcare workers and children, as well as people who care for infants. Flu mist being only able to be used for people who are aged 2 to 49 and who do not have an underlying health problem. With the production of this strain, we have cut no corners. This flu vaccine is made as flu vaccine is made each year by the same companies, in the same production facilities, with the same procedures, with the same safety safeguards. We have had literally hundreds of millions of people vaccinated against flu with flu vaccine made in this way. That enables us to have a high degree of confidence in the safety of the vaccine. It has an excellent safety record. We wish we had had the vaccine earlier. It would have been great to have had it back in April or May. But the current science doesn't allow us to produce it really in much less than 6 months, and that's what it has taken to produce it at this time. People have concerns about vaccination. People always have concerns about vaccination, and that's understandable. We would all rather if we didn't have to take any shots or take any medicine and could stay healthy. But vaccines are one of the truly great scientific inventions of science for going back for hundreds of years to the first vaccinations. And the flu vaccination, being tried and true, is very effective. What we're seeing still is an excellent match between the virus that's spreading throughout the U.S. and the strain that was chosen to make the vaccine against. So we expect a very good match, a very good degree of efficacy of the vaccine. It will work to protect you if you get it in time. Now, there are three major concerns that people have, despite the clear message from all of us in public health and from doctors throughout the healthcare field that vaccine is our best tool to protect against the flu. Vaccine is the best tool to protect against the flu because not only does it prevent people from becoming severely ill, it also prevents the spread of flu. The first concern that we hear is, oh, flu is just a mild illness. Actually, on average, flu is not a mild illness. It can make you pretty sick, knock you out for a day or two or three, make you miss school and work, and for too many people, end up sending them to the hospital, to the intensive care unit, and tragically, some people may die from it. In fact, this year already, we have seen quite a few children who have died from flu. So, although it is not a disease that will send lots of people who get it, a large proportion of people who get it to the hospital, it can be very serious. And even for those for whom it's just an average case, it's no picnic. And you'd much rather avoid it for yourself and your kids. And the best way to do that is with vaccine. The second concern we hear is that the vaccine may not be safe, that corners may have been cut, that shortcuts may have been taken, that it's a new or different vaccine. And in fact, none of that is the case. The vaccine is made in the same way it's made each year. Each year, we look at the strains that are circulating, and we select the ones that are likely to be in the population. We put those into the flu vaccine, and that is exactly what has been done in this case. It is against specifically H1N1 influenza. It is made in the same production facilities, by the same companies, with the same methods as it is made each year. And it is the same type of vaccine of which hundreds of millions of doses have been given. My children will get it. Other public health and societal leaders and experts will get it or have their families get it. It is something that we have a high degree of confidence in. The third concern is that it is too late for the vaccine. Well, it's too soon to say it's too late, because we don't know what the rest of the season will bring. Even in places where flu has been widespread, it's affected maybe 5 or 10% of the population. That leaves 90 or 95% of the population that's still susceptible. Flu vaccine is our best tool to protect against the flu. And though we wish we had it earlier, we can't predict what the future will hold, and we know that vaccination is our best tool to reduce the impact of flu. Just to let you know where we stand now, all states have placed orders. More than 2 million doses have been ordered, nearly all of the doses that are available. More doses are becoming available each day. When the states learn that vaccine becomes available, they place an order which doesn't just order one big supply. It orders it by the provider. So the states, at each state level, they identify a certain number of people who will receive, or facilities which will receive the vaccine, and how many doses they will receive. The state then allocates that out to different providers to receive vaccine. There are different formulations of the vaccine, the flu mist or the shots. The shots can come in single-dose vials or multi-dose vials, and all of those have to be factored in when the ordering is done. It's then shipped from 4 different warehouses, temperature controlled so that it stays at exactly the same temperature until it gets to the place where it will actually be given or further distributed to be given. If it's the shot rather than flu mist, it travels together with or at about the same time as injectable materials, needles, syringes, alcohol swabs, materials to dispose of the needles. So it's a very big and complex undertaking. It will be different in different parts of the country. Some parts of the country will do lots of school-located vaccinations. Some places won't do so much. Some places may be better prepared than others. Our goal is to help as many places as possible prepare as well as possible so they can start as soon as possible and vaccinate as large a proportion of people who want to get vaccinated as possible.